Hello, it's Anthony Chadwick from the Webinar Vet, welcoming you to another podcast. This is a date-sensitive one. We're going to be talking about the antibiotic amnesty that is happening in the UK in the month of November. So if you're listening to this in another country at another time, hopefully it will give you some good ideas to sort of copy the model that Ian and others have developed over the last few years. But I'm really excited to speak to Ian. Ian's a good mate of mine, helped to get me through university. No, he wasn't my lecturer. He was just in the group with me. We both qualified at the same time from Liverpool. And Ian is now a professor at Glasgow University. I kind of knew that at university, which is why I stuck close to him and he helped me get through the course. So, Ian, as always, thank you for coming on and thank you for your place in my development as a veterinary student and veterinary surgeon.
Thank you very much, Anthony. That was a wonderful little introduction. You didn't tell anybody anything too bad.
Yeah, no, that's good. Well, you're a good mate, and you've done an amazing amount for the profession. And this is just the next innovation. I think, like me, you're kind of interested in the whole area of circularity. We create a lot of drugs that actually never get used, and they end up sitting in people's drawers, in their cupboards. Human drugs, obviously, animal drugs as well. And I think we have a duty to make sure that those antibiotics are safely returned because, we had a health secretary not too long ago who actually, admitted to flushing drugs down the toilet, which is not really the ideal way of disposing of them, is it, Ian?
Absolutely not. And it used to be time in previous years, but that was the advice, was to get rid of it down the toilet. But we
Mm.
realize now that the level of antibiotics in our water, in our soil, and so forth is rising, and it's easy to detect these things. And if you have low levels of antibiotic, of course, it's much easier for bacteria to become resistant. So you end up with two problems. First of all, damage to the environment by these drugs causing a death of bacteria and so forth, which is on the one hand a problem, but also on the other hand, the growth of drug resistant bacteria in the environment. And these feed through into our daily lives. People who go swimming in the sea and so forth are exposed to these drug resistant bacteria. We know that surfers who surf in UK waters have a 3 times higher rate of carriage of antimicrobial resistant organisms. And this leads to all sorts of issues about public health, but also environmental health. So we really want to get to those people who, like that health secretary, are flushing things down the toilet, sticking it in domestic waste, and to encourage them, when they decide to get rid of their drugs, to get them back to a proper disposal facility.
Mm.
And that is the vet practice. And obviously, if a vet practice has prescribed the drugs, the logical place for people to take these drugs back is back into the vet practice. Every vet practice in the UK should accept drugs that are returned. It is a requirement of the Royal College of Veterinary Surgeons practice standard scheme that every practice has a route for disposal of those things, usually through your clinical waste supplier, and that really is. So this is no more than highlighting something that we should be doing
Yeah.
anyway. But because of the Antimicrobial Awareness Week in November, we try to run this amnesty idea in November to coincide with that, to say that to people during the month of November, let's talk to clients about getting these antibiotics back. And it simply starts with the question, do you have any leftover antibiotics at home? And we know that a lot of people do. About 45% of people who have had a prescription have some left over. Okay,
Hmm.
what that says about compliance is a rather
Yes,
interesting
is another
question.
thing. And of course, a campaign is always useful because actually we should just be accepting these and it should be the normal process. I think also there's probably a side of people, we've got a cat here. It might be difficult to dose. After a few days, people give up. The cat gets better. They almost don't want to admit to the vet that they've been a failure. So there is probably a side there, but there's definitely an educational piece going out to clients, both in human and in veterinary medicine, that we have to get these drugs back to keep things safe.
Absolutely. And people will admit also to keeping on to these drugs so that they can use
Yeah.
them next time without going
Yes.
to the vet. But they also know that doing that is both dangerous and likely to be counterproductive. So there's a sort of a pull from both directions in doing this. So people will often hold on to them for a while, but after a while they realize they're not going to use them. And that's what we really want to get through is once they actually take the decision to dispose of them, we want them to dispose of them properly. I
Yeah.
don't want to try to get too far down the line of trying to get people to bring them back too early because almost they if they do that, they've paid for them, they feel they own them, they want money back. But at some point, they have to decide that they're going to get rid of them. And
Yeah,
that's the point. We
definitely.
want to get them back into the vet practice so they can be properly disposed of.
And of course, it was interesting. We were chatting earlier on this week about people don't even know necessarily what an antibiotic is. So, in the amnesty, I know you had all sorts of ectoparasiticide products
hmm
returned as well, and wormers and so on, which similarly is not a bad thing because we don't want those leaching into the environment
Absolutely.
either, do we?
No, absolutely. I mean, all drugs should be brought back, and
Yeah,
to that, I would also add any endocrine products because they're
of
hormone
course.
disruptors in the environment. There's almost no drug that it's safe to put into the environment.
Chemotherapy, etc., etc.
Absolutely,
Yeah.
absolutely.
So, Ian, just for people listening, obviously this is in the UK. As in all good things, we kind of saw the NHS were doing something useful and we've piggybacked off it, which I think is, eminently sensible. We're in the third year. It's grown really quite well over the first 2 years. Obviously, a lot of work from you and Fergus Allerton starting it. But now I know you've got a lot of support. Obviously, Webinar Vet, the BVA, the BSAVA, RUMA, which has been set up very much for that whole attitude of using antimicrobials in a sensible fashion as well. But that's all well and good. And obviously, there's a lot of communication going on. But talk a bit about the practicality. As you said, everybody has a waste disposal company.
Mhm.
I've just been to a waste expo down in Birmingham at the NEC, and actually, we need to stop talking about waste as waste, but it's actually a resource, and how can we use that resource in a sensible way? But certainly, we shouldn't just be throwing it away into landfill, which is, the worst form of circularity. So, um, talk to me a little bit about the practicality of how you might be doing that in Glasgow, for example, or in other places.
So what we do in Glasgow is that we have little round stickers which you can get on the Ruma website, and we've ordered sheets of stickers, and these
Yeah.
just say, "Please bring back unused drugs." Little green stickers, and you just stick them to the cardboard box or the paper bag that they are being dispensed medicines in. Um, and that's one easy way of nurses and receptionists and vets getting this message out that it's a special time. We only do this during November. We only stick those stickers on during November, and it works really well. And we get these stickers from Amazon. So you take the design from the Rumor website, you put them on the Amazon site, and you get these stickers usually within about 2 or 3 days. We
So
also
a
have
fairly small cost, I presume you have to
oh
pay
yeah,
for
yeah,
them.
yeah, yeah.
Yeah.
We do a big run, so it's not a huge expense. We also have posters in the waiting room. We have a video running in the waiting room, and we encourage our clinicians and our receptionists, particularly who are front of house and involved with this, to have this conversation with clients and to ask them, do you have any unused drugs? If so, can we have them back? We get quite a lot of drugs brought in by our referred patients, so they come in with drugs already prescribed by the practice. So we always take those in and dispose of them
Yeah.
properly
If
rather
they
than
don't
giving them
need,
back.
obviously, if they don't need them, often you're
Yes,
going to change
absolutely.
treatments and things. Yeah.
Absolutely. Yeah, yeah.
Yeah.
So that's an easy way of doing it. I know other practices, primary care practices, have a more direct targeted campaign using social media. So they have big practice databases and big practice followings and so forth. So they'll put things out on their Facebook website, and these social media posts are all available from Ruma Companion Animal from their website. Um, we get practices to sign up to this, and then they get a drip feed, and it makes it much easier for them to deliver new content onto their website, so that there's something positive going through their website, showing how the practice is trying to be environmentally responsible, and they can also link to the videos then and so forth. So using a social media, I'm afraid we don't do so much on the social media side because we don't have quite that kind of numbers of
Yeah.
clients. But
Of course.
that works really well to get the message out, and above all else, just starting that conversation in the consulting room every time someone comes in. As they go, do you have any leftover drugs? We're trying to collect them to get them out of the waste units and out of landfill. We're trying to make sure that we recycle them through the practice. And some people are going to turn around and say no, but that shouldn't put you off asking, because apart from anything else, you can then also have a conversation about the environment and about antimicrobial
Yeah.
resistance, and why looking after our antibiotics is in everyone's interest. And looking after them doesn't just mean how you prescribe them to the animal, it also means how you get them back when they haven't been
Yeah.
used.
Just to be controversial for a minute, obviously we've taken the drugs back, which you're right. We've dispensed or another practice has dispensed. It then goes into a special container, and we send it off to our disposal agent, whoever that is. My feeling is very much that there is a responsibility not just for the vet practice, because obviously as a vet, often the book ends with us and we end up having to pay for all of this. I do think that companies have a responsibility to accept this back as well, to pay for some of the disposal of these drugs, which I know isn't in place at the moment. But with a circular economy and with a circular production, that we have a very linear economy at the moment, which is we produce, we use, and then when it's finished with its usage, we throw it away. We need, I think, as a profession, to become more circular. And those listening again before London Vet Show, I have the graveyard shift, Ian, on 4 till 5 on Friday, when I will be talking about this. So anybody who's listening to it before London Vet Show is finished and wants to come along, you would be most welcome, because it could just be me and one man and his dog. Who knows? But we will see.
Well, yes, I mean, I agree about the circularity argument, but so there's two groups of people who need to be involved, besides the practice, and the first of those is the obviously the drug manufacturers,
Yeah,
and we're very pleased that Zoetis have taken a lead and taken a responsible line and are supporting this campaign. So they are particularly taking a lead with this and have been very helpful. Their reps are out and about talking to the practices about this. They're giving financial support to this campaign. So they're exercising good responsibility here. But I would also say, as well as that, there's also the distributors. And
yeah,
in that, I just have a little call out to the distributor, the main distributor in Northern Ireland, who is the veterinary supply company. They've taken it on themselves to distribute the posters with the drugs. And distributing advice and so forth. So these practices in Northern Ireland don't even have to print out the poster. The supply company will do that for them, and they can just go and stick it up on the wall. And I've been looking for supply companies to take on board that kind of responsibility as well, because they also have some equal part in all of this, and they don't have to pay money. they just have to help.
Yeah.
They can actually get the message out there, and they can help without necessarily costing them a lot of financial things directly. And ditto Zoetis and others. It's more about engaging with it and talking about it and helping practices do it that will achieve results, rather than just because I mean, people talk about the polluter pays, but I don't think that's the right thing. I think the polluter has to take responsibility, which isn't quite the same thing. You can do a good job without necessarily paying a lot of money to see it through.
And, again, I've been out of practice a while, so just to be clear, are we putting this in with other, our bottles of propofol and so on, or are we putting this in a separate area because it's antibiotics, or are they just all going and then presumably being incinerated?
So what we'd like practices to do is to try to keep the antibiotics to one side
Yes.
during the month of November, because then they can count them up and see how much they've got back. Okay. But then, yes, to actually dispose of it, it all goes in together in what's lovely called the dupe bin. I can't even remember what dupe stands for, but
I
basically it's
remember I remember dupes.
yeah. So
Yeah.
dupe bin. So it all goes in the dupe bin, and then goes out for disposal by your the company that removes your clinical waste for you usually.
Yeah, but actually, as you've said, we want to be able to measure how effective messaging is getting over, and part of that is how many practices are involved. And I think there was, over 100 last year, but also the quantity. Because if everybody brings back, 5 amoxicillin clavulanate tablets, it's not a lot, is it? But if people are bringing back lots of old antibiotics, then it is already having an effect. And this will only grow. I mean, it's all about you've got your early adopters, and then more and more people go, no, we must be making sure that this is happening because we have a responsibility to take those drugs back. And presumably, people do start bringing human drugs back, but they really should be going to pharmacists, shouldn't they?
Absolutely, and there are plenty of farms. We haven't had any human drugs brought back so far. They've gone to pharmacists, and I would encourage people not to start taking human drugs
Yeah,
back
because it could
because you
it could
actually
be.
don't know what you're handling then in some
Yeah,
instances. So
yeah.
so I think that we should be clear about
It's
that.
just for animals.
Absolutely, but you said 5 tablets. If everyone in the UK who owns a pet
Yes,
brings you back 5 tablets of antibiotic, that will be about 2 tons of antibiotic out the environment. It's a huge amount.
exactly. Yeah,
So
yeah.
I'll be
Hopefully,
very
not
happy
every
if
animal in
everyone
the country is on antibiotics, though, Ian. That would be the
five
vets are
tablets of
obviously
anything, but
overprescribing it.
they
Yeah,
are coming. I mean, what comes back generally is 5 tablets, and that's fine. Five
yeah. No,
tablets
no,
because of
exactly.
the mass effect. No, I mean, if somebody turns up with 140 tablets of
Yeah,
antibiotic, one client
yeah,
turns up with 140 tablets of
yeah,
antibiotic,
yeah.
you've got to worry what's going on there.
Well, they're certainly not giving it to the cat or the dog, are they? So
Well, I'm
yeah,
not sure they should have ever been prescribed it in the first place, is more my
well,
point.
and that as well, obviously. But I think that the point is, if it's just one client putting drugs in, that's not significant. But once we have a campaign and we're pushing this out, of course,
Absolutely.
a lot of people will want to bring back. We're doing something similar at London Vet Show, having a Repic box, which is um, for computer wires that people and for devices that they no longer own, but they still have the power pack for it or whatever. And the amount of copper in there, I saw a piece of research coming out that there's 266 million pounds worth of copper, that isn't recycled, that is in our drawers, has been thrown into landfill, that has a real value. And actually, it's just about how we collect it. And this is the same thing with the drugs. There's no value to them, but obviously there's a value in keeping them out of the environment, out of our rivers, etc., etc. Ian, that's really great. The amnesty obviously finishes. Is it just early into December or the 30th of November?
30th November is when we sort of draw a line under it, but then we ask people to complete a survey during the next couple of weeks, so that we then before Christmas basically we find out what people have done, and that way we then get snapshot of what we
Yeah.
think has come out of the amnesty.
And I know significantly, you were saying to us that last year, first year, it was very BSAVA orientated in the people that had been involved and sent surveys back and things, whereas um, BVA and Webinar Vet have actually contributed quite a lot of, people have found the link or whatever. And we just
Hmm.
hope that that's going to increase and we'll obviously continue to promote it. It is the 8th now. This will go out early in next week. Um, so, I would just encourage anybody listening that if they can start collecting those antibiotics, go onto Amazon. The posters will come from, where is that going again, onto the
There'll be
Rumour
a
website?
link at the end here. I hope that you need to go to RUMA Companion Animal. So the Responsible Use of Medicines Alliance, Companion Animal, RUMA Companion Animal and Equine. We're the people who have all the resources on our website. RCVS Knowledge has some stuff as well, but mostly it's on RUMA Companion Animal. And practices go there and download and
And
print
they
your
can print
print
them
your own
themselves.
print your own
Great.
stuff.
Or send them to a printer to get done
Yeah,
in a
yeah,
bigger
yeah,
size.
yeah, yeah.
No, that's fantastic. And that's obviously, again, very practical. We're not sending stuff out unnecessarily. And in fact, this could even be something that we put on our, a link to our website and obviously on this podcast as well, so that people
Yeah.
can go direct. So do look underneath at the information side, and we'll make sure, Ian, that we put all the links in that you provide us with. But obviously, I've spoken to both you and Fergus. I know how passionate you are about it, and it is, as you said, and maybe I was being a bit flippant, and apologies if I was, but if everybody does a little bit, it actually adds up to a lot, which is what I talk a lot about just with any environmental commitment you make, stopping using pop plastic bottles.
Hmm.
I think there's something ridiculous like 7 billion plastic water bottles are used every year. And of course, a good percentage of those go into just rubbish on the streets, which can get into the water. Obviously, a certain amount go into landfill, a certain amount is burnt. The more that we can think of ways of actually avoiding waste in the first place, the better. And, Ian, your point before about even the antibiotic courses that we're now sending out, history is sort of a bit cyclical. We used to talk, particularly in dermatology, about long courses. All of that is changing, using less antibiotic. Actually, the best form of circularity is just to dispense less in the first place, isn't
Absolutely,
it?
absolutely. Maintain a good dose, but use a short course.
Yeah. And use of shampoos, etc., if we
And
feel that they can be effective, topical treatments
topical
and so on.
shampoos,
Yeah,
antibacterials,
yeah,
urinary antiseptics. So if you've got
yeah.
a dog with a recurrent urinary tract infection that you can't get rid of, things like old drugs like hexamine, which is now known as methenamine. This is still an effective urinary antiseptic that can work very well in some cases, and thus significantly reduce your use of antibiotics.
Changing that pH environment in the bladder can have a massive effect, can't it?
Absolutely.
And this is why I say that red injection that we used to always give, minus the white creamy bit, we now discover that vitamin B12 is actually really good. And certainly, well, it's not a waste anyway. So, Ian, thanks very much. I really appreciate the work that you're doing, and I'm sure a lot of vets listening in. We know how busy you are, professor at Glasgow and everything, seeing cases still. So I think this is such important work, and it's that whole idea of One Health that if we don't look after the planet, then it's going to be more difficult to look after ourselves and our animals, domesticated and otherwise as well. So thanks so much. And I think it is an amnesty, but actually, this is something that we should and could be talking about all year, isn't it?
Absolutely. Absolutely. This is a targeted campaign for what should be happening all year.
Yeah, great. Ian, thank you so much. I will hopefully maybe be seeing you at London Vet Show next week. If not, I'm sure we will bump into each other very soon.
Yeah. Okay.
Thanks,
Thank you
Ian.
very
Thank you
much.
so much for coming on. Thanks, everyone,
Thanks.
for listening. Do consider, getting these resources. I think the more people who can get involved, bringing that stuff in, as Ian said, the weight is already significant, but it'd be lovely to increase it in year 3 as well. So thanks everyone for listening, and hopefully see you on another podcast or webinar very soon. Take care and have a great rest of the day.